Welcome to Lisa Albanowski's Business Forum. Today I have with me Grace Marie Horan-Luce, and she is with Senior Health Plan. Grace is a Medicare professional, and I am so happy to have her here. I know that this is a great time of the year coming into October. So welcome, Grace. I'd like to know welcome. I'd like to know a little bit about how you do your business, and if you would describe it a little bit to us.
Sure. My business, I own an agency, and the main focus of the agency is Medicare. We do Medicare all year long. We guide and assist anybody who's eligible for Medicare to choose the options that go with your Medicare best, the supplemental plans, the Advantage plans, or the drug plans.
So what made you decide to go into this kind of a business?
I myself was currently on Medicare. I was disabled for over 25 years. And when I was in Medicare, nobody helped me. And somebody was helping me, and they said they were opening an agency, and I do that. So then I chose to do it because it did give me the opportunity to be a mom. I was a mom and I wanted something, the availability, plus I was still disabled and I could do it at my own pace. So that's how I got into the business.
Interesting. So where are you originally from?
I'm originally from Hopesville, New York. I'm a Long Islander, always have been here. Will not always be here. Do not want to retire here though. Sorry.
So you're a Long Island girl. You were born and raised here, and you really know the climate of the Long Island community then.
Yes.
That's really great. A lot of people are not in a geographic area that they serve, and they sort of don't even know the climate or the culture, which is great, Grace, that you really are born and raised here and a true Long Islander. What's something about your business that people don't know?
A lot of people are unaware that there are even brokers that help people with their Medicare constantly. Where do you come from? I've never heard of anybody like you. And they're unaware that there is no cost to have us guide you through the Medicare process. Everybody always thinks there's a fee when there's never a fee to let us help you. If someone's charging a fee, they do not do Medicare.
So Medicare is a health insurance. And let's explain a little bit, if you would, for those of us who don't know what Medicare is and who gets Medicare.
So somebody either has to be disabled before the age of 65 to be eligible for Medicare, or turning 65, then you are eligible for Medicare. If you or your spouse has worked 44 quarters, then you're automatically entitled to Part A. And Part B is the doctors, the hospital, and everything. You have to pay a fee for that. A lot of people are unaware of that. When they get in Medicare, they think it's all free. It's not. But Medicare is to help complement what you have as a senior to help go with your other plans, the supplements, the drug plans, and the Advantage plans. Medicare is an insurance plan for people when they retire.
So you're really an expert in this field. And what you were saying about people charging, you don't charge for a consultation so that somebody can call you, and if they don't know what to do or where to start, that's what you mean by no cost.
Yes, we help do an analysis. My agency is a little different. We help guide you through the process of signing up for Social Security, giving the forms, whether you're continuing to work beyond 65, which is pretty common. We have the forms on the website on a resource page, or you can get them from Social Security. If you're higher income, when you retire, there's a form you fill out, an income adjusted form. If you have a death, we help people with that, just help them. There's the forms, and they contact Social Security. But most people that do what I do, they don't even know what those forms are. We just try to guide people a little better than most people that do what we do.
So it's really a specialty in the healthcare arena for insurance, right?
Yes.
It's a specialty. And, you must have some memorable experience that a client had doing what you do and serving the people and the public like you do. Can you tell us a little bit about that, if there was one?
Sure. One person that comes to mind is one of my clients called me up and had thanked me. Her husband was sick for a year, and he went in and out of the hospital and in and out of rehabs, and he actually did pass. And she just wanted to thank me because he was in a supplemental plan that the only cost it cost her was a little over 2,000. It was actually $2,490 for everything. So she said, Grace, I just want to thank you. I have no debts. And we were able to get all the care we needed without any problems. And I just want to tell you, thank you so much. Even though it was the worst year of her life, at least she didn't have all this debt to incur and bills to go after because she did choose that option.
And I guess that's the expert in you to be able to help people to manage their liquidity and, you know, keep some money in their pocket if possible.
Yes.
For the right Medicare plan.
Right.
Right. Keep coming back to that. And that's a beautiful thing when we can help people, right? Because that's what being an entrepreneur is, and being in business is all about, right?
Yeah.
So what's new or exciting that people should know about now in your business?
So right now is the annual open enrollment period for anybody who's currently on Medicare, whether you have a private drug plan, a PDP, a prescription drug plan, or an Advantage plan. That's the Part C. This is the opportunity to change the plan October 15th to December 7th. On October 1st, the new plans roll out. Everybody at this point is getting their summary of benefits for next year, the price increases, what's entailed for next year, and this is your chance to change the plan that you're in. A lot of seniors make a mistake that they don't do anything. They think they're good. That is not what you should do. There's a reason there's an annual enrollment period. So everybody, please take advantage of it.
So it's October 15th,
15th till
December 7th. And if somebody misses that deadline, then they're out of luck until next year?
There are, depending on the plan they go in, there's different enrollment periods, there's special enrollment periods, there's other times, but this is your opportunity. Some people cannot change again. This is it. Yes.
So really the message is now is a perfect time for people to speak to you.
To do an analysis.
And so you do an analysis. So what happens if they're on a plan now and they're not, they don't need to change? What would you tell them then?
Well, at my agency, we actually monitor everybody who asks to be monitored, and we review their medications. That's critical because if a drug is not in formulary, you're paying the full price. You just think that's expensive this year. No, you're paying the full price. So we do an analysis, and if you're to stay, you receive an email, you are good. And if not, they hear from me, and we would have to change the plan.
So what would someone say that they love about your business?
Would someone say they love about, what would I love? Okay.
What would your clients say that they love about your business? That you do monitor them? Like, that's where I'm going with
Yes.
this. Maybe I'm wrong.
No, we definitely help them and guide them. I mean, I always say we're a phone call away. If someone has an illness, please call me first. If something's going on, high cost of medication. Another thing on the website, the resource page has probably 10 or 15 medications you might be eligible to get for free. A couple making about 70-something thousand can still get medication for free. If you're making more than 80, no. But I have assistance programs through the companies that you might be able to get medication. So we definitely are there to be with you, you know, all the way through the process, from the beginning to, you know, as long as you're in Medicare.
So you're not just somebody who's going to provide them with a plan, you're also going to give them a lot of resources as well. That's what I'm hearing. And it's all on your website, a lot of this information too.
There's a resource tab that has the forms on it I spoke about. New York State EPIC, which is an assistance program in New York State for seniors making 75,000 as a single, 100 as a couple qualify. They don't care about our assets, what we own, what we have in the bank. That's a wonderful program for people to go into to help with the cost of medications. I'm a big resource person. Sometimes I feel like I'm a social worker because, you know, today I spoke to 4 different children, the caregivers handling their parents. It's devastating. They don't know what to do. They're sick. You know, it is a process. So you have to definitely try to find someone to help you. When you call the company only knows about the company. They hang up, they're done with you. When you have someone guiding you that does something like this, we have an array of companies. We do not do every company, of course, but we have an array of companies and we move you and change you. I actually send you to companies, drug companies, if they're not, I don't represent them. We'll still monitor you, but if that's the right choice for you, you're not going to go to us and spend an extra $600 for the year. Just not something I would do.
I remember when my mom, I was an advocate for her, so I would be the child that you're referring to, and she was in a plan, and I didn't know any better at the time, and I just, renewed her every year, renewed it every year, and then once I met somebody like yourself, and you started to like make my head spin about all the things that are out there, it's just really something that you should not, as a layperson, take on yourself. So I really appreciate, the fact that you really care about people. It's not just about your business. And I think that's what separates you from the pact. As a person myself who deals with seniors in my real estate practice, we are people who care about doing the right thing, and then the money follows in our profession, right?
If you do the right thing, it'll come back to you. I always believe that.
Right. And why do you think it's important for people to shop locally with somebody like you?
Because we know the area, the plans in our area. I mean, I do the whole East Coast just about, but I don't know those area plans as well as I know my own, because we're here, we service the area, we look at the plans, your area. You know what's eligible in this area. So it's definitely beneficial to do that for sure.
And what do you think is important in the neighborhood? What do you want to see most improve? Can you give me any tips on that? Is it, something related to your business, of course?
You mean Medicare itself or
Yes.
here? Well, I could tell you
Yes.
something that most people are unaware of. Long Island is still considered rural. Medicare has not updated it. So therefore, we do not receive benefits like people who are in the city. They get extra benefits, they get discounts, they get health cards to their plans. They get extra benefits because they consider us rural. We are not rural anymore. So until Medicare updates that, other places in the country have that, but we really are not has as many plans as people in Queens and Nassau, because they're just not out here, because we
Wow.
are so rural.
Wow. So that really needs work
Yeah, definitely.
from the high level. And how do
Yep,
you
from the
change that?
government.
I guess you keep lobbying for that.
Yes, just like the prescription drugs for seniors. Same
Interesting.
thing.
Interesting. Um, so what's the best way for people to reach you, Grace?
They can either just call the office. My office is located in Hauppauge, and they can either call or email, or on the website, you can ask to be contacted, and you can just fill out a form, and we usually get back to you quite quickly. And any way would be adequate to reach out. And I try to get back to people within 24 hours.
Do
I do
people
my
have,
best.
okay, I'm sorry. I didn't mean to interrupt you. I know you do. You're really right on it. Do people have to come to your office, or can they do this work over the phone?
We do a lot of it over the computer now with COVID. So you can either have a virtual meeting. It can be done through email. People can come to the office. I do see people in the office. We're still 6 feet apart. At this point, I don't go into anybody's home. I'm not comfortable with that yet, but you can have somebody come to your house. But it's done through the computer, and I fill all the forms out. You just have to hit a couple of buttons. That's still challenging for some people, and if you can't do that, we can do it through the mail.
Oh,
You can, but the process is, there's an intake form. They fill it out on the website, fill in some information. We'll do an analysis, get back to you, and then we'll discuss, and then we'll make a plan going forward. What's the right way to go?
and like you said, a lot of the seniors who are the older seniors have advocates, whether it's a family member or someone helping them with their financial side of things. So those people are very literate on the computer and how to pull down the forms.
They can
You did,
help them do it.
right. So what's the phone number people need to reach you at?
631-933-1888. That is the office in Hauppauge.
And repeat the way of contacting you through your website.
The website or email, the website is sr-healthplan.com. and my email is grace@sr-healthplan.com.
So the name of your business again is
Senior Health Plan Specialists.
with a S,
and we're
plural.
located in Hopewell. Yes.
Great. So
And
easy to,
people don't, oh, I just want to say something. People don't really have to download the forms on the website. They just fill them out and hit a button and it gets emailed right to me. So
okay.
that you don't have to do that. You can download it and scan it if you'd like to, but it comes right to us.
So basically open the website, go to the form, fill out the information, type it in, and then hit send, and it goes
And
to
then it
you,
just goes.
and it's easy as pie.
Well, for some of us.
Yes, yes.
And I'm not a computer person, so I don't take offense when they say they cannot do the computer, then we'll schedule a 15-minute consult to take them the doctors and the medications. And then after that, we'll do an analysis. Not
Well,
everybody's computer literate, so.
right, and you do the mail, and you said that somebody would come to the house. Is that one of your staff?
Yes, yes.
Okay,
I mean, I have gone outside since COVID. I mean, I know some of my brokers go in the house. I'm just not comfortable. I feel you don't know what's in somebody's house. Outside, it's outside. I feel it's a little better.
yeah, I understand. You know, we all have to be safe in our world of today. It's the
Mhm.
new normal, and we're
Yes.
not here to judge. We're here to help people and be courteous and kind and work within the constraints of whatever somebody's comfortable with.
Right.
So I really appreciate the time that you took today. I'm Lisa Albanowski. I'm a real estate associate broker with Signature Premier Properties. I'm a seniors real estate specialist. Grace and I have known each other for several years in our senior networking. We're here to help. And this is very important now because of open enrollment, like Grace said, October 15th to December 7th. So call her for a consult and make sure that you have the right plan. Thank you so much, Grace. I appreciate your
you.
time. Be safe
Thank you.
and
You too. Be well.
enjoy the rest of your day.
Thank you. Have a great
Bye.
day.